Welcome back, everyone. We have on the show today one of our favorite people. She has been such a wonderful friend to Hot Flashes and Cool Topics, and now she's a friend of Oprah's and Kelly and Mark's and Dr. Heather Hirsch. Welcome back to the show.
Well, thank you so much. I'm so excited to see all the things that you guys are doing and have been doing. And so I'm excited to be here.
We are thrilled to have you, and we're excited for you because you are launching your new book. Your book is out, and the title of your book is Unlock Your Menopause Type, Personalized Treatments, the Last Word on Hormones and Remedies That Work. And it is fantastic. It is fantastic.
Oh, have you?
It really is.
I'm
Yes.
so excited for people to give me feedback because the instantaneous feedback you get on Instagram or TikTok, it is so polarizing to the 2 years I've been working on this with no feedback,
Oh, no, I thought it was incredible. I always say I wish I'd had it when I was in Perry because it is so
Yeah.
informative and just everything in there. I mean, you've got different methods that you can treat the different types, and we'll talk about those in a minute, but also nutrition solutions, non-hormonal solutions, hormonal solutions, if that is something that you want. Just everything in there. It's very comprehensive, and I think it's going to be such a great benefit to women that we just really needed a book like this.
Oh, well, thank you. It was a kind of crazy undertaking. Like all of the things that I have been learning from over the last couple of years as I've ventured into entrepreneurship is like niche down and focus on one thing and target one area. And so for this book, I was like, I'll help everyone, whether it's HRT or it's non-hormonal or it's over the counters or it's the best supplements or what's hogwash. It's incredible to think about how much is in there. And I really am also, like a lot of people, my harshest critic. And every time I read through it, I'm always like, wow, like how did we do this? So much credit goes to my writer, Stacey Colino, who wrote the book with me. She's on the cover of the book, because the credit really needs to go where credit's due. And while I gave her so much content and so many ideas, the way she packed everything in there, she is such a big part of how we got this in here so nicely.
Well, we read obviously a lot of books on menopause. That's just one of our job requirements. And I can honestly say that this is probably one of, if not the most comprehensive menopause books that I have read, honestly, because you take a very matter-of-fact approach as if I'm talking to my doctor, like as if I'm coming to see you personally with questions. And you start off by saying, okay, let's talk about what menopause is and what it's not. Let's talk about the myths and let's myth bust, which is so important because as I was reading those myths, I'm like, yeah, we get a lot of listeners talk about this. Yes, we get a lot of listeners talk about that.
Yeah.
And then you go
Right.
into the 6 different types that you see most frequently. And then you go into hormonal and non-hormonal treatments. And it's just so incredibly comprehensive. I thought maybe we could start with the beginning about menopause and why you wanted to start the book with just kind of structuring what menopause is, what it's not, and about the myths that women come into your office complaining about.
Oh, well, of course, I have such a nice team helping me with this, editors and writers. And so I'm glad that I had this opportunity to make sure that this book actually made sense to readers. But really, truly, a lot of times when I am talking to my patients or students or anyone on social media, I'll kind of, forget that some of the what seems to be basic or obvious definitions, are very confusing. For example, what is the difference between the menopause transition and postmenopause? What is the difference between bioidentical HRT and just whatever else there is, right? When is perimenopause? What What is it defined by? When does menopause end? So these really basic understanding of your body is actually the core thing that I think as women, we're all missing. Is like, what are these changes? How do they happen? And how do they work? And so I think one of my gifts that I have accepted is that with joy, is that I have this great ability to take comprehensive physiology or research and explain it in a way that makes sense. And so hopefully that first part of the book, explaining what is menopause, what it's not, taking out some of the hogwash so that, you don't have to worry about balancing your hormones postmenopausally or things that you hear a lot on social media. And then breaking down some of these really common myths kind of then set yourself up to like get ready to get on your path, get some resolution, get your priorities straightened, get treatment.
Yeah, I agree though too. It was something that was so easily readable. And you explain even when you use big terms like I can't even say it. You're a genetic. I can't even say it.
Yeah, right.
That
GSM, Bridget, just
there we
GSM.
go. GSM. But even
Good old
you say
GSM.
there, you acknowledge, yes, this is hard to say, but this is what it is.
Yeah.
And it just was really great just to understand not only if I knew what type I was because you have a quiz in there to figure out what type you are. And I kind of knew it anyway, but I was like, I'm going to do this quiz anyway, because I think that's really cool to do.
Yeah.
And just to also, as a woman, to learn about the other types, because then when you get around with your other friends and you can talk to them and you can help each other out, I thought that was great.
That's it's one of my secret joys of this book is that I hope that makes it so shareable and really helps to open dialogue with kind of this fun, like, oh, what's your type? Oh, I was the mind altering. Woo. Oh yeah, I remember that. What was your type? I was the silent type. Oh, well, you still have things you need to think about. Like, I hope that, not only is it informative for the woman reading it, but that it's something that would make for just such a fun book club, because we always say, all of us in this space, is that one of the things that's going to help is opening the dialogue. So I really hope that my book does that. I can't wait to see sort of how this unfolds in the next couple of weeks and months.
Well, let's talk about the 6 types that you put in the book. You have the premature menopause type, and that's the first type, the sudden menopause type, the full-throttle menopause type, which Bridget had. There's a picture of Bridget under.
There is.
The mind-altering menopause type, where you would find my location, the seemingly never-ending menopause type,
where
and finally the
overlap.
silent. Oh, that's true.
I overlap with the
overlapping. But let's start with number 1, the premature menopause type. Can you tell us about that and why it became one of the 6 categories?
The premature menopause type is so near and dear to my heart, because what's really unique about this is that for women who are certainly under age 40 and also under age 45, the actual definitions are premature and then early menopause, respectively. The literature, the science, the data, whenever you Google menopause, it truly doesn't apply to this group. It's a completely different physiologic process. Now, it's not like they're kind of the same thing. Like diabetes and hypertension are both cardiovascular diseases. So these are kind of both like endocrinopathies, but diabetes and hypertension are still different. So premature menopause is physiologically, psychologically very different. The gold standard of care is hormone replacement therapy, because without it, you're at increased risks for more diseases. And so it becomes less of, I guess you could say, like a choice and more of a definitive treatment plan. And of course, the biopsychosocial of that woman's life is completely different. While her friends are trying to get pregnant or breastfeeding, she's now in menopause. And this happens to 5% of the population. I honestly, either It's more, and it's underrepresented, which is probably true, or I just see it because, patients seek me out. So I have that sort of bias of being a menopause expert doctor. But, that it's not completely, rare to the point where it's just this very unique thing. And nowadays, because of, and a lot of times there can be a combination, as we'll talk about, sudden, often from surgery or chemo. But for now, women who are selecting to risk reduce for cancers, because we can easily find more genetic mutations that put women at higher risk, they find themselves in these premature menopause types. So it may even be slightly increasing. Plus, there's also, a phenomenon of having children later in life. And while I don't necessarily know that that definitely puts a woman at higher risk for premature menopause, I do see a trend of, maybe assisted reproductive technologies or infertility treatment, and then maybe a sooner menopause or a sooner perimenopause. And so the premature menopause type is really so different because for so long, I think these women and doctors just used data on natural menopause and applied it to them, and that should not be the case.
Right. And you make the distinction very clear that that is truly hormone replacement therapy and not menopause hormone replacement.
Yes,
Yeah,
actually,
hormone therapy. Yes,
yes.
yes.
When I teach my students, like my healthcare providers class, HRT is what we always say. It's even probably what I say on social media, but that's really the hormone replacement therapy is really for our younger women, and HT, or hormone therapy, is what you use for natural menopause.
Again, that's such an important distinction, but one that most of us would not even know. And it's so important.
Right, exactly. Yeah.
Because, the more information that we have as lay people when we go into our doctors, the more help we're going to get. Because we're going to be able to ask the right questions. So that kind of leads us into the second one, which is the sudden menopause type. And that's usually surgery or chemo. Can you talk a little bit about that?
Oh, yes. This group of women for whom are undergoing chemotherapy, pelvic radiation, usually this sudden is actually premature menopause or premature ovarian insufficiency. In a lot of those cases, unless it's surgical, there is some perimenopause in there. And this book leaves room, hint, hint, for maybe a perimenopause book down the road, but because this book is very focused on menopause. But in sudden, it's like going, boom, you're in menopause the next day. You wake up in menopause after your surgery, or you get that first infusion of chemo and your ovaries are like, okay, we're close shop here. And so it's this very sudden sensation, or Lupron, which is a medication we use for endometriosis. And sudden, it can be a big shock to the system because there's no perimenopause. And if there's any biological reason for perimenopause, it's to slowly get your body prepared for menopause while still prepared is in quotations, because sometimes it doesn't necessarily, it's not what it's actually doing or feeling like. But I think that's its sort of biological mechanism. But sudden, and not only that, but now the biopsychosocial is my life at risk? What about my health? Women could be suffering from side effects from chemo and put into menopause, anxiety from a new diagnosis and put into menopause, suffering from chronic pelvic pain and put into menopause now with Lupron, and all sorts of other things that are going on in a woman's life can really impact menopause. And this group in particular, of all the groups, may have the most women who are not good candidates for HRT. And what's so important about sudden menopause or women who aren't candidates is that it doesn't mean that you are totally doomed. I talk a lot about HRT on social media, mostly because there's so many myths and misconceptions. And yes, it can be very efficacious and keep you healthy. But one of the things I want to really make sure here is that whether it's vaginal health or sexual health or mood or sleep, if there's some other problem that's really affecting your quality of life, we can still work on this it doesn't have to be that HRT is the one and only answer. That's really important for all my listeners and for all women to know. And not only that, but what are the different types of exercises you should do if you went into sudden menopause? What are the different headspace things that you can do to love your new body? So I think that you can already see they're so different in this, just 2 out of the 6.
Mhm. I love in the book the woman that you used as an example in the book that you spoke about or wrote about, that when you met with her and discussed and she had a plan. When she went into her surgery, she had a plan afterwards so that
Yeah.
it went so much smoother for her. And I
Yeah.
felt like that is such a benefit for so many people
Yes.
because so many people go through this. And gosh, if they knew that they could have a plan of
Yes.
what
On
to
the
do
other
next.
side, I couldn't agree with you more. All the stories in this book are true. They're real patients. Of course, names and professions are changed. Um, but I actually sometimes tell my patients this. I say, I know this is not the silver lining here of everything that you're going through, but you'll be more prepared than your friends who are going to be bewildered and confused and have all these lingering symptoms for years. I've got a plan for you. You're going to either get your chemo or have your ovaries removed, and we have a plan on the other side. And if that is really comforting. And I hope that this book can help women who are going to actually know they're going into sudden menopause. It sounds weird, but you might know you're getting your chemo, you might know you're getting your surgery, right? And feel so much more prepared than, just feeling so lost and then still so anxious about all those things that happened.
Yeah, I thought that was just, I thought that was such a great comfort and just something just there that they could have. And then the one that I had,
Yes,
Full
Bridget,
Throttle.
you have
Full Throttle. Oh my goodness. Yes.
Yes.
Yeah. So you could share a little bit about that, or you could just look at a picture of me if anybody wants to see
Right.
the video
It's
of this.
that,
Yes.
just what it sounds like symptoms from head to toe. It's insomnia, mood changes, irritability, hair thinning, trouble sleeping, trouble focusing, hot flashes, night sweats, vaginal dryness, weight gain, dry skin, dry eyes, dry hair, brittle nails. I mean, right. You could just keep going. And
Yes.
it might not have to be all of those, right? But you just kind of feel it from head to toe, just all over. You feel your body really changing. And I give the example of my patient who was an orthopedic surgeon, physician's assistant. And, she came into my office in Ohio and she's like, Dr. Hirsch, like, I will get hot flashes in surgery and like my goggles will get foggy. And I'm like, this is not okay. And she's like, I know. So, the Full Throttle is interesting because interestingly, and this is just something that I've seen like as a trend. By no means is this research oriented. It's really just from my decade of seeing patients. But I often find that with Full Throttle, it kind of like as fast as it comes on, sometimes it's actually as easy just to turn it off, usually by HRT if the patient wants to, is willing to, etc. It's almost like a little goes a long way. I don't know why. It's just what I've seen over the last decade is sometimes Full Throttle of all of them can kind of be knock on wood.
Yes.
It sounds like there's no way that could be easy to treat, but what's so fascinating about Full Throttle is that oftentimes, there's 6 or 8 different symptoms and patients, go from doctor to doctor, dermatologist to the sleep study to the GYN to the, starting a weight medication to the weight loss clinic. And it's just because the estrogen has been lost. And it's interesting. It's like the Occam's razor. Sometimes when we replace the estrogen, not always, but sometimes it's like all those 8 symptoms, a lot better. Not that life will be perfect or that HRT cures everything, but, it can do a lot of things.
It really helped me. And luckily I was a good candidate for it. So it really was helpful. Yes.
So now we're going to go into my favorite and the one that would have my picture underneath, which is the mind-altering menopause type. And that one is one that kind of is the mood shifts and the brain fog and memory. And as I was reading information in your book about that. One thing that really struck me, which I had not considered before, was you talk about HPO versus HPA, which is hypothalamic pituitary ovarian axis. So now you've got the ovaries, you've got estrogen, and when your estrogen starts to drop, it goes to almost like an HPA, which is your adrenal glands, which are your stress glands. And I was like, oh, well, that makes sense why my anxiety went from being crazy to being absolutely like mind blowing. Can you talk about the brain fog that still, I mean, I'm postmenopausal and I'm still not back to where I was before. Can you talk about that one?
You know, there's so much of the physiology that we still don't know. But again, as a clinician, as someone who's watched this and sees this firsthand, this is such a common experience. And not all women have it to the same degree. And it's interesting. I think there might be geographical variations in terms of, when I lived in Boston, this was such a big complaint. And, it's like a city full of intellectual women. Not that their city is not full of intellectual women, but you know what I mean? I think there's some geographical variations. But the thing that I think struck me the most is that for some women, they would say, yeah, I have some hot flashes, but like, I mean, I can't function at work. I don't feel like myself anymore. All of a sudden, I have depression. I have suicidal ideations. I've had patients tell me, I would say the most common thing I hear on a very serious note is not that I have an actual plan, but like, if the tree fell on me, okay. I hear so many, and they say, I just was never like that, Doctor. Or the patient that I used in my book was a professor at a university, and her whole identity shifted because she really couldn't function at what was her big thing that she loved, and that was her identity, being a professor and grading her papers and quizzing her students. And how embarrassing to be standing in front of a lecture hall talking and then have just completely lose track of what you were saying in the middle of your sentence, and just be in front of, I don't know, 220-year-olds. And so it just could really change, your productivity, if you're going to stay working, if you're going to retire, if you're going to leave the workforce. So everything there, I think, is so vital, because when we think of menopause, we kind of sometimes think of the full throttle, right? Hot flashes, night sweats, that we kind of think hot flashes, night sweats, if anything, those two things. And when your symptoms are predominantly brain fog because of increased cortisol and stress hormones, and it's a vicious cycle, it just keeps going because you're more stressed, because you're more anxious, and you're more stressed because you're not productive, and you're more stressed because you want to figure out how to retire. It's so difficult. I had a patient come to me this time in Boston, who is an accountant. I think this is in the story in my book too, but these stories just stick out to me because she said, I quit my job. And I said, okay. She said, I didn't make a mistake. I work for a huge company, and if I make a mistake, this could cost so much. And I knew I was going to make a mistake. I knew I couldn't keep up. And so I just retired. What significance that is that women who are at the peak of their careers, we're so skillful, we have such emotional intelligence, we've worked so hard, we have raised families and worked and done all of these things, or we've raised families, now to have this second stage where we get to really focus on our dreams and our goals, and to just not feel like it, would not be able to do it. It's just such a loss to society, not just the woman herself and her family.
With patients who are like that, would HRT be recommended? Would they be a good or is that something that's not necessarily going to help with those symptoms?
So the short answer is yes. The short answer is yes. The longer answer is, certainly the guidelines still say that SSRIs or SNRIs, or medications more for mood. There are some medications that can help with brain function and cognition, like dopamine agonists, things like Wellbutrin, even sometimes stimulants like Concerta or Vyvanse. these can all be options. And, most of the evidence base will say these should be first line HRTs, could be a great addition or could be a good second line. Now, in truth, the way I practice is I use a lot of shared decision making because in reality, I sometimes get patients come to me and say, look, I remember being on Paxil in my 20s. I remember being on Adderall when I was in college. I didn't like them. I didn't like the side effects. I didn't feel good. It didn't help. And I'm interested about in HRT. And so sometimes, there's just so many different ways you can build Mr. Potato Head, right? Like, sometimes I will start with HRT. My patients will say, wow, like because this happened at menopause, that really helped. And sometimes they'll say, but I'm still just a little bit slower. I say, okay, do you want to try a teeny bit of Vyvanse or Concerta? Or, of course, I always look at diet and lifestyle, but I think as a clinician, as a doctor, I'm most helpful in making people make bigger decisions with medications that need to be prescribed. So sometimes we work backwards. Sometimes they try HRT and they say, no, that wasn't it. And so, there's always the textbook answer that's, the right answer on the test. But in real life, women come to me with different experiences, different goals. And a lot of my patients nowadays, more with each passing year, I actually always ask my patients this. I say, it's kind of a funny question, but I say, do you Colleen, Bridget, do you have any guesses or thoughts of what might help you? Because you may have been doing some reading or you may have been doing some researching late at night, and I want to meet you where you are. And lots of times nowadays, my patients say, I'm wondering about progesterone. Would that help me sleep and make my brain fog better? They bring up things. And so, I like to use a lot of shared decision making to help with my patients. So that's kind of the short answer. Yes. The longer answer, that's really what I get to do with my patients on an individual basis is help them kind of decide. I know I talk so much. How are we going to get through this episode?
No, but I think that is such a relief that I know so many times different physicians that I've visited throughout my life, and it seems to be getting better the older I get. But just to have someone willing to listen to them, to have a clinician that will listen to them and honor their thoughts. And then if it isn't a good decision, you have something there to tell them why, and not in a condescending way, which is such a relief, to every patient. And
Yeah.
you were talking about the workforce, and that is coming to the forefront now is
Yeah.
just what women are facing during
Right.
menopause in the workforce. And I think, your book has just it addresses that. And it's so nice that it addresses all these things. And so then the next type is another one that I somewhat experience. I overlap a little, is the seemingly never ending. Well, while I'm on the estradiol patch and I take progesterone at night orally, and that has helped tremendously. But there are still things. I mean, it helps. I used to get like 10 hot flashes in an hour. I really did.
Oh my.
It was horrible. And
Ugh.
now it's like, okay, it's really not, I might get a little bit every once in a while, not bad at all. But there are other things that still, like the joint ache, and it's just funny. But can you share a little bit about the never ending one?
Yes. The never ending, there's probably a subset of patients that I see in their, let's say, 60s or maybe that 5 to 12 years since menopause, right? And it's a wide range. And one of the big things, and maybe it's unlike you who, luckily kind of have been thinking about this for a while and, got to interview a lot of experts and things. But, one of the things I think here at the seemingly never ending is it's clear evidence of, like, I hate to say it, but like, the misguidance that women have had or the ways that they have sort of been, ignored with their symptoms or never even asked, right? So the subset of patients who's kind of in this, like, let's even say 5 to 15 years since menopause is like, well, I had these hot flashes, but no one ever said anything to me. No one said there was anything I could do. I just thought they were going to go away over time. These are some of the themes that I see for the never ending is sometimes it's just that they never got the chance to talk about it. And sometimes it's also that myth of like, well, my doctor just said it's going to go away. And, or sometimes it's really an issue of prioritizing ourselves because we are so used to, as women, taking care of our children. And I have 3 of them. And so it's so much. And then your parents and your house and your spouse and your pets. I always say that by the time you look down, you're like, it's been 6 years since I've had sex because it feels like knives going in my vagina. Gosh, it's been longer than it hasn't been 6 years. Yep, 6 years. Whatever it might be, right? Maybe it's not sex. Maybe it's, and all of these things are so normal. I cannot tell you. There's nothing that you could say that it would either shock me because we are more alike, I think, in the things that happen to our bodies than we think. Or maybe it's, I haven't slept good since, my last baby was born, and now it's been 2 decades and I'm sleeping 4 hours a night. And actually now it's getting worse. It's like more like, disrupted 4 hours of sleep, and years just go by. Like, time is a funny thing. So seemingly never ending is these women for whom, the symptom was never so bad that you shook your doctor and you were like, I don't care if you say there's nothing I can do. Like, I am dying, right? It's kind of like they were never that bad, but they either just went ignored, or they were just misguided, or they really, thought it was just going to go away. Time has just gone by.
Yeah, it's, and then that leads to, if has gone by, the other health issues that can come about, the cardiovascular issues, osteoporosis, osteopenia, all those things that go by. And so it's so important to have that addressed in there.
It really is. And that's why, kind of back to this point of like, I hope this is a good gift or book club or really shareable so that, and easy to read, so that we don't have to have someone who's, 12 years into menopause sort of saying, gosh, I didn't think there was anything that we could do. Because I've been saying this a lot more on social media as I get more confidence, I guess, in having a more stronger opinions, but that I truly believe that you're going to, your health is going to decline more if you just suffer, right? Because you just are going to develop more chronic diseases. And actually, even though it's a natural process, right? Death's a natural process, childbirth's a natural process. Just because it's natural doesn't mean that there's anything good that comes out of it. I don't know where that kind of came from, right? And that treating it is actually so much better for your overall health, and whichever ways you decide to treat it. So, that's sort of the never ending, or the seemingly never ending, was probably the last one that came to me. The types, and I came up with these types on a plane ride. I don't know where I was going, but I came up with it like on a plane, but it was kind of like this group of women that had these like more like vague complaints that were just never so bad. And that those were the trends that I usually saw. They just were always misguided or misunderstood or misdiagnosed and given wrong and terrible information. And, that's kind of where that came from.
With the last category, which is the silent menopause type that usually most women don't experience, because I think you said 75% of women will have some symptoms, but for that small percentage that don't have symptoms, that kind of glide through menopause, you do make it a point in the book to say that's not going to keep you from having challenges as you get older. Can you talk about that?
I think this is, while yes, it's probably, rare, sort of in between, not as rare as premature menopause type, but certainly there are women who don't have symptoms, but their body still changes. It's just that they don't feel it outwardly, like Bridget, right? Or like you, Colleen, just with like feeling that brain fog. And so, we talked about this a lot on the Oprah Daily panel. Maria Shriver, really interested in brain health, and Lisa Mosconi's doing a lot of research in brain health. So we see so many changes to the brain despite a woman never having a hot flash, doesn't matter. The brain is still going to change. And of course, you have to be living under a rock to know that your bones don't change, or sorry, that your bones do change. And so your bones health is going to change. And I gave the example of my patient who had a spinal fracture on Thanksgiving, who was, sailed through menopause, playing tennis, doing great, not even like 2 pounds of weight gain, who is this little unicorn, and then had a spinal fracture. And so one of the things with silent is that because you feel so outside, you may be a little bit less prone to make sure you're getting your routine screening or ask about some of these things that clinicians, really aren't as preventative with. For example, for like a bone density, there is guidelines that say if you don't carry a lot of risk factors, you should do a bone density at age 65. I think that's way too old. And so, it's so important that even if you don't have a hot flash and you're one of those lucky women, it doesn't mean that you still, you can't ignore basically tuning up your body.
And then there's part 3 of the book, which is a survival plan. And I really appreciated, because you kind of were like, okay, here's a list of symptoms, check off, scale of 1 to 5, and then pick 3 and let's run with those, because that's digestible. Women can understand that. And you give both hormone and non-hormonal, like I'm not on hormone therapy. It's not that I wouldn't go. I just wouldn't go on. It's just I haven't felt the need to. But I still have to be aware of my diet, of my exercise, of my brain health, getting out in the sun. It's so digestible what you have there. How did you put that together?
Oh, well, thank you. This is great because really you guys are hearing this first time I'm getting this live feedback from other people than my small circle of editors and writers who've read it a trillion times. These are all things I really do with my patients. One of the things that I do with my patients is if you've ever seen me as a patient, I say, if I had a magic wand and I could fix your top 3 symptoms, what would they be? Or I say all sorts of cute things. If you had a genie in a bottle, but the prioritization of your symptoms is really helpful, because then you can kind of start by what is the one that's really bothering me the most, whether it's psychologically or whether it's, the domino that's really kind of getting everything. And so I have all my patients really do that, is list their priorities. And interestingly, because that's what I'm going to kind of mold treatment on or make recommendations on. Because if I just, let's say Bridget comes in with Full Throttle and I leave you with a list of like 20 pages, like that may sound great, but it's not. It's just so overwhelming. You don't really know where you want to start. And then you'd probably rather just take a nap like that. That's what I would do. And so, I kind of like doing it in these bite-sized actionable steps. And so that's something, this came from what I really, my decade of treating menopause is really helping women prioritize. And interestingly, it changes. So, every time my patients back, I'll say, these were your 3 priorities. Are they still? And they're like, well, the sleep's better. Boom, check. Okay, now it's libido. Okay, let's move that up to number 1. Now let's tackle libido. Or maybe it's that, 10 pounds that I want to lose, whereas now I'm sleeping, so I've lost 7. So now I'm going to like really tackle it. So that is one of the things that I've really helped my patients do, is prioritize and watch those priorities change. And then the other thing I like to do with my patients is called war mapping. And it really kind of sounds like, what is the plan? Where war mapping you can do for anything, me and my husband did this. We war mapped on Friday night because we had a birthday party and dance recitals and in-laws visiting. So it's like, you go there, you do this. This time we do this. And, but you could do the same thing with your health. Like, okay, I kind of will say, all right, let's repeat your bone density in 2 years. Let's check your A1C because you had polycystic ovarian syndrome. Let's check your A1C every 6 months and your cholesterol every 6 months. And okay, I know you hate mammograms. They hurt, they squeeze. You never want one in your life. Let's do one every 2 years. Every 2 years? Okay, great. And so we kind of warm up and think about your health going forward. Because once you feel great or you feel better or you're thriving, you feel good, then what? you know, and so it's great. And you know, what is the path forward? So that's really what's in chapter 3, along with that DIY menu, which is the DIY, sort of like the do it yourself, is, you know, certainly there's a part of this book where you can't just go out and do it. You need you often will need a doctor to prescribe something, maybe, but not always. Or it might, you know, spur a seed in your head, but you certainly cannot, you know, make the final decision, write it yourself, right? So I also give you some things that you can just start to improve your lifestyle that are, and you know, the book is backed up by so research and so much evidence. And so that's kind of what's in not chapter 3, part 3.
Yeah. And it's funny, Colleen, that's exactly what I was going to talk about, that part. So you read my mind. But I do think it just makes it so comprehensive. This book is, I think it's really, like Colleen said, really one of the most comprehensive, easy to read, just it gives you the information. And it, like you said, so many people think of full throttle when they think of menopause. They mainly, you've said, hot flashes, night sweats. And I can't tell you how many people have said to me, oh, I really just didn't have any problem with menopause. And I'm like, oh, I remember you telling me you're heavy period. Well, guess what?
Yeah.
Yes, you did.
Yeah.
And I
Yeah.
think that this is just going to be so helpful for them. Just how you put after each type, the diet, the exercise exercises that you could do, and how interesting
Yeah.
it was that one
Yeah.
exercise for one type
Yeah. So
isn't
different.
necessarily the one for the other type. And
Yeah.
I think that's really important to see that as well, that, okay, maybe that's
Yeah.
gonna, I know for me, I think you were like more of a yoga or a Pilates
Yep.
or a full throttle, because you're not getting everything going
Yeah,
yet.
you don't need to get those vessels squeezing anymore. And for
Yes.
Colleen, that like mind altering menopause type, you know, that's really, well, movement's always medicine, but so important for the mind altering, which is, you know, I really have different recommendations there. Um, and so, you know, really, I so sincerely appreciate your thoughts and feedback, and doing a whole show on this book. I'm so grateful.
Oh,
Well, we're
well,
grateful that you wrote it, or that you and
exactly.
your partner wrote it. Yes, we're so grateful
And
for
for
that.
the listeners who don't have access to maybe a menopause certified doctor and want questions to be able to say, yeah, but you know, I read this book
Give
and
it to
Dr. Hirsch, yeah, that's what I'm
Yeah.
saying. Like you're bringing it, I read this book. Here's my highlighted page with the sticky note
Yeah,
where that's
yeah,
me. And
yeah, yeah,
it just gives it gives women a feeling of power over what happens to them. And that's so
yeah.
important at this age. I wanted to touch on, well, first I wanted to touch on what it was like to be on Oprah. But before we get to that, um, how do you feel about some of the new stuff? I know Fezolonitant was just approved, and that's
Yes,
a great option for non-hormonal treatment. There's things coming
yes.
out now. How do you feel about the movement towards more options for women?
It's wonderful. It's always going to be wonderful, wonderful, wonderful. I mean, so long as you know, what is important to me is it FDA approved, which means it's been rigorously studied for its safety and its efficacy. So that's, you know, certainly what I talk about in the book when I'm talking about all types of things. And hopefully I did a pretty good job of explaining, you know, why FDA approved, that there are FDA approved bioidenticals, which is, you know, the buzzword. So one, that they're FDA approved. And and two, you know, there are subsets of women for whom just having options is so great. There may be women for whom, you know, don't want this or don't want that, or if they've tried already this and they want a different classification of medications, that is great. The second thing that's really important to me is also cost. You know, the hard thing is that, for example, like Vioza, it might be expensive when it first comes out, and we're gonna have to work on reducing costs, and we're gonna have to, you know, do some advocacy and some probably some marching and some things like that, because the war is not necessarily over yet. So the medications, mostly what I'm seeing, especially if something's FDA approved. I mean, that's like once in a decade. We don't get a lot of new medications for menopause, or maybe 2 or 3 in a decade, right? Like last year, or last decade, we had Duvet and we had Addie, which is flibanserin and Vyleesi. So this year we've got Veoza, and actually Duvet is back. I just got word Duvet is going to be back coming June 2023, which is another form of HRT. Now, what gets difficult is sort of the over-the-counters, the devices. These can be great, especially devices are usually safe, but they could just kind of hurt your wallet a little bit. And then, over-the-counters and supplements, it's hard unless it's something tried and true. But oftentimes these are just, maybe repackaged and the price. So the price point I worry about. And in the book, I do talk about some of the things that are, probably snake oil that should be avoided.
Yeah. And I know you talked too about testosterone and the use and how that is a tough.
Yes. Oh my gosh.
Yes.
We haven't even talked about
Yeah,
that.
yeah.
That's in my book too.
Yes.
And, testosterone is, such an interesting topic. And certainly I love, using testosterone in my patients for whom are good candidates and want to try it and whom benefit from it, because there's so much we can learn there.
Yeah. Yeah. And it's hard though. Is it not? Is there an FDA approved or no? I didn't think so. Yeah. Yeah.
Right. And, so that's what makes this one hard. And it's funny. I say this to my patients too. I say, okay, I know I told you not to get compounded things and, everything has to be FDA approved, and then I launch into my testosterone.
Right.
So, I can get it commercially available by essentially diluting a male version of a male prescription of testosterone for females. And that's what NAMS actually recommends. And that's what I tend to do a lot for patients. And especially while we're talking about testosterone, for low libido, for premature menopause, these can be really, really important keys to their treatment plans, their war mapping.
Mm-hmm. Yeah.
When we first talked to you, it was 2020, the beginning of the pandemic. We interviewed
I was
you.
in my basement.
You were in your basement. You had just opened the midlife and menopause clinic at Harvard, Brigham and Women's. And Bridget and I were just absolutely just enamored with what you were doing and how you just were kind of, oh, well, this is what I'm doing. And I'm like, I don't think you realize the magnitude of what you're bringing forth here for women of our demographic. It was like you were like at the precipice of this tidal wave that has taken over the menopause conversation. And you've gone from that to now having your own practice and just casually sitting next to Oprah. Talking about, hey, just, there's, Drew Barrymore and, Maria Shriver, just
Maria
casually.
Shriver. And
Could you ever imagine, number one, could you have ever imagined that? And two, what was that like?
Oh my gosh, no. Well, I had this old vision board. I should put it behind me on this podcast wall that I made in 2020, and it has a picture of me talking to Oprah. And the funny part about this vision board is not that came true, but underneath there's a picture of me skiing. So I've met Oprah, but I've not ever gone skiing, guys. Okay.
Well,
Skiing.
meeting Oprah, you won't break your legs. So
That's true.
that's
true.
Yeah.
It's a little safer.
So, it's funny. I'm so I wake up every day still thinking what an amazing blessing that was and what an opportunity that was. And I mean, definitely one that's hard to beat. And, to have such a renowned public figure like Oprah sharing only, tips about menopause, but her own story about menopause. It's so inspiring. It's so exciting. And it was just an amazing experience. I was a little nervous beforehand. But when I was on stage, I honestly felt like I was talking to my patients. I felt like I was talking to women just like I do every single day. So the truth of the matter, which is what Oprah said, and you couldn't really say it better, is that, you can't have enough money to get out of menopause. You can't live in a certain place to get out of menopause. I mean, you can't outfox the big M is what Oprah said. And that's true. And so sitting there with Oprah and with Drew and with Dr. Malone and Maria Shriver, it felt like I was at that moment, and we were on that panel for a while. I just felt, as I do every single day, talking to women, because you could be, Colleen, you could be Bridget, you could be Oprah, and the same exact questions, have the same questions. Why did no one tell me this? Why did I go see this doctor who put me on a heart monitor and it did nothing? Like, why did it take so long for Heather for me to get treated? Why don't we know anything about this? Same questions. It's universal, and it's universally felt.
Yes.
Well,
It
we
certainly
are some of
is,
your
yes.
and we're some of your
Yes.
biggest supporters, because we appreciate
I
all
know.
the
Thank you,
information.
guys.
Honestly,
Yes.
we hear from so many women who struggle, and we hate that
I
we
know.
can't, that they don't have access to the information
Yeah.
that they so deserve. And so books
Yeah.
like yours, Unlock Your Menopause Type, is going to be a resource that is invaluable for a lot of
I
them.
hope
And we
so.
appreciate it. And we just hope that the next time we see you, maybe you'll have your own talk show. There you go.
Yeah.
Yeah. Let's talk.
That's, I
menopause.
gotta say, I would, that would be so amazing. And every time I bring this up and I say this, I'm like, don't you think women would tune in to, especially if it's a midlife women's health? And everyone always says like Dr. Oz. I'm like, not like Dr. Oz. Well, kind of, yes, but like better, and more, like not like that, but like kind of like that's what we all think of, which we're all like, no. But
Yeah.
a show that was really based in truth and sincerity and evidence-based, that was really for women, oh my gosh, it could be amazing. But thank you guys. I am so thankful for all that you are doing, because you are also giving women so much knowledge and access and relatability to what it is like to be going through menopause, and all the collective voices putting on these conferences, and getting community, we all have a big part to play. And so I'm so lucky that I have what I would consider colleagues like you, in this space, all working together.
Well, thank you.
Well,
We
thank you so
appreciate it, because
much.
we just pretty much talked about your book for an hour. So we appreciate the fact.
Oh, yeah.
I
You had
know,
the
guys.
time.
Thank you
No,
so much.
we're thrilled, and we can't wait to share the episode. And thank you for writing this book. We appreciate it so much that you came on.
Thank you, guys.